Chapter 4 in Phantoms in the Brain by Ramachandran is titled The Zombie in the Brain. In this chapter, Ramachandran discusses the visual system. Towards the end of the chapter, he mentions two syndromes that have been observed when damage to the new pathway occurs. These syndromes are the Kluver-Bucy syndrome and Balint syndrome. The human brain contains an estimated 30 distinct areas for processing images. Each of these areas is highly specialized for extracting different attributes from an image. There are two main pathways in the visual system. One is phylogenetically old, and the second, newer pathway that is most highly developed in primates. The old pathway is an early warning system that helps with orientating behavior. It tells you where the object is. The newer pathway helps to determine what the object is and how to respond to it. This picture shows where the visual information is entered and stored in the old and the new pathway. The old pathway is also called the where pathway. It goes from the eye to the superior colliculus and then to higher cortical areas, especially in the parietal lobe. The new pathway is also called the what and the how pathway. It goes from the eye to the lateral geniculate nucleus and then to the primary visual cortex. From there, it branches out again into the what pathway, which goes to the temporal lobe, which also houses the majority of the 30 visual areas, and the how pathway, which goes to the parietal lobe. Kluver-Bucy syndrome is diagnosed when there is significant damage to the what pathway, or the anterior temporal lobes. There are 6 categories of symptoms that are associated with the Kluver-Bucy syndrome. The first one is psychic blindness, which is the inability to recognize objects for what they are, even though visual acuity remains unchanged. The second is hypermetamorphosis, which is when you reach for an object as soon as it is presented visually, even if that object has been associated with negative rewards in the past. The third is extreme changes in feeding habits. In the research done with monkeys, this included them ingesting large quantities of meat, which most never do. The fourth is hypersexuality, which is significant increases in masturbatory, homosexual, and heterosexual behaviors. The fifth is changes in emotional responses, which is when you can remain calm under normally anxiety-producing circumstances. The sixth is oral manipulations, which is when there is manipulation of the lips, teeth, and gums, and it's when you examine objects by licking, biting, and chewing. The two pictures at the bottom of this slide show the hypersexuality of a cat whose anterior temporal lobes had been removed. Current research has shown there are many causes to Kluver-Bucy syndrome besides removal of the anterior temporal lobes. The most common cause is herpes simplex encephalitis, which is a viral brain infection. The picture to the top right shows a CT scan and an autopsy of someone who had this disease. Other causes are surgical lesions, Pick disease, cerebral trauma, cerebrovascular accidents, temporal lobe epilepsy, heat stroke, and Alzheimer's disease, which is shown as a picture to the bottom right. Treatments for Kluver-Bucy syndrome are symptomatic and supportive and may include drug therapy. Carbamazepine, which is an anticonvulsant, is the most commonly prescribed drug. Antipsychotics and selective serotonin reuptake inhibitors are also used. Ramachandran also mentions another syndrome called Balint syndrome, which is diagnosed when significant damage to the how pathway, or the parietal lobes, occurs. There are 3 symptoms for Balint syndrome. The first is oculomotor apraxia, which is the inability to intentionally move your eyes towards an object. The second is optic ataxia, which is the inability to accurately reach for something you were looking at. The third is visual simultagnosia, which is the inability to take in the entirety of a picture. Instead, a person only sees parts of the whole. Another way this can be described is having tunnel vision.
Grab it with that hand.
This video is a patient who has Balint syndrome,
Can you see
and
it?
it accurately shows optic ataxia and visual simultagnosia.
Take a crack at it up here, if I hold it up closer. All right, how about now that you touched it with that hand, can you reach with the other hand and grab it? With your right hand?
With my right hand?
Uh-huh.
No, I can't.
If I wiggle it, does moving it help you at all?
Nah, well,
Yeah, it does a little bit. So motion sort of pulls you toward it, like. What do you see here?
a comb,
Mm-hmm. What do you see now?
comb,
What do you see now?
spoon.
Do you see the comb?
No,
Do you see the comb?
yeah.
Do you see the spoon?
Mm-hmm.
What do you see now?
I see the spoon,
What do you see now?
comb.
Do you see a spoon at all?
Yeah.
Okay. Can you see what? Just tell me what you see.
I see what looks like a blackboard with some writing on it.
Mm-hmm. And there is a blackboard with some writing right behind us. So when you lost track of what was there, you picked up whatever was right in front of you, I guess. And you can see the writing, so it's your acuity's okay. You can see the writing.
Current research shows that there are many causes for Balint syndrome. Some of the causes are trauma, post-cardiac arrest, near drowning, stroke, metastasis, eclampsia, HIV, posterior cortical atrophy, and Creutzfeldt-Jakob disease, which is shown as a picture to the right. There are a few treatments that have been observed. The first is the adaptive or functional approach, which involves functional tasks utilizing the person's strengths and abilities. This is helping them compensate for problems or altering the environment to lessen their disabilities. This is also the most popular approach. The second is the remedial approach, which involves restoration of the damaged central nervous system by training in the perceptual skills, which may be generalized across all activities of daily living. This could be achieved by tabletop activities or sensory motor exercises. The last is multi-context approach, which is based on the fact that learning is not automatically transferred from one situation to another. This involves practicing of a targeted strategy in a multiple environment with varied tasks and movement demands, and it incorporates self-awareness tasks. These last two slides are references that were used in this presentation. Thank you for listening.